This is the most important issue, the most important domestic issue facing the country. This is a moral imperative to give all our people health care, make it available to everybody. And we don't have it, and it's a huge national shame, I believe. We spent $2.2 trillion on health care, $2.2 trillion. That's about 20% of our GDP by the end of 2008. European countries, Canada, spend about 10% of their GDP, but they cover everybody. Yet we have 47 million uninsured, and we're all paying for that uninsured population. So we get a terrible bang for our buck out of those $2.2 trillion. Now, what would I do? What I would do is look at our whole healthcare system, and I would discover, we all would, that 31% of our healthcare system is administration and bureaucracy. It's not direct care. 31%. You know, that's lack of computerized records. That's lack of information on health of millions of our citizens. It's you know, the money you pay to HMOs to administer this. It's just fat. You got to reduce that. Now, these are the steps that I would take. You mentioned one of them, Medicare, because the problem is cost and coverage. The first would be Medicare 55 and over. The second would be a grand bargain, and the grand bargain is that the states should handle S-chip programs, which are very good and not properly funded. Kids and families, working families, should be handled by the states. You know, no waivers. That's what you do. Medicare should be seniors and the disabled. Have a division of responsibilities. I mean, today, what is the case? There's 50 Medicaid programs. Culver has one. I have one. We have 50. There's how many Medicare programs? There's about 100. Yet 4,000 Americans lose their health care every day. 80% of premiums have gone up. Premiums in the last 4 years have gone up 80%. You know, just so you got to deal with cost and coverage. So Medicare, division of responsibility, states and federal government. Go down also to 55. What else? The federal health plan. Everybody should be eligible for that. The plan that the Congress gets, the federal government gets. You can't pay into it, but be able to get into it. And I believe you would see a lot of people get this and be satisfied.